Hi, my name is Dale Cow. I'm your local New York Acteon rep. I'm here to talk to you a little bit today about the Acteon Newtron P5 piezo scaler. You know, dentists are always asking me, Dale, what is a piezo? Or what's a piezo scaler in comparison to my Cavitron scaler that I currently have, and how would it benefit my office? Well, I'm here to tell you. The biggest difference that I always say is the technology. A Cavitron uses a technology called magnetostrictive technology, which causes a vibration of the tip to move in an elliptical motion. So typically it's going to be moving in a figure-8 motion. So when you're taking that tip and you're using it to clean the calculus off the tooth, the tip is essentially making contact on and off the tooth, which in turn makes it a lot chatterier for your patients. So discomfort level is a little bit increased. Whereas opposed to a piezo scaler, the tips are going to be moving in a linear motion. So the tip's going to be moving up and down. So you're going to take the lateral edges of that tip and you're going to use that to clean the calculus off the tooth without taking the tip off. It's going to be a lot more comfortable for your patients. Aside from the increased comfort levels, one of the most important things, in my personal opinion, is that because of the way the tip vibrates, you get so many different options in terms of applications that you can use for the tips. Whereas maybe a Cavitron, you'll use it for hygiene prophylaxis, maybe some tips for perio. With a piezo, we have 80 plus different tips to choose from thin perio tips for subgingival applications. We have tips for endodontics, tips for finding calcified canals, removal of broken files, canal access, irrigation tips, things of that nature. Obviously, we have a wide selection of hygiene prophylaxis tips for supragingival, subgingival cleanings. There's also tips for restoration for perfect margins on crowns and veneers prior to prepping. We also have tips for implant maintenance. Okay, so this is a big one. We're currently the only ultrasonic company on the market right now that makes implant maintenance tips out of pure titanium. Pure titanium is typically 2 grades softer than actual titanium. So when you're using it to clean biofilm off the threadings of the implants, you know you'll never hurt the implant. A lot of times they've done some studies with plastic tips, and once that's worn down while you're using that with a electric scaler, there are possibilities of leaving debris behind. So using the pure titanium tips with the P5 piezo will surely be the most safest, most efficient way for implant maintenance. I do have a catalog here that does highlight a lot of the different tips that we carry. I'll be more than happy to email a full catalog to you if you just want to get in contact with me. And one thing that you'll notice is that on the bottom of our tips, there's going to be a little colored ring, okay? And what that colored ring indicates is the max power that each individual tip can withstand. So the lowest power on the setting here on the unit, you're going to see that it's illuminating green. So this power setting is going to be for all of our low power thin perio tips for subgingival cleanings, okay? The next increment is going to be yellow. That's going to be for all of our endo tips. The next one is going to be blue. This is going to be a pretty high power. This is going to be for any kind of hygiene, prophylaxis applications, okay? And then the highest is going to be orange. We only carry 2 tips that's going to be coincide with the orange power setting, and that is going to be our crown and post removal tip, okay? So again, as far as the options that you have with the piezo, it's very, very versatile. It's one unit that can do a lot of different things for one office, okay? And you know, some of the clinical benefits in comparison to a Cavitron is this. When you are using these units on back-to-back hygiene patients, when that handpiece is just working all day long, with a Cavitron unit, a lot of the times the handpieces typically get pretty hot. Okay, so the recommendation to cool down the heat is typically to crank up the water a little bit, which in turn obviously is going to be a lot more water into the patient's mouth. It's a lot more suction that the assistants have to do, and you're typically giving them a free facial, okay, without charging them. All right, but when it comes to a piezo, the way that the tip vibrates, it's actually 4 ceramic rings inside the handpiece that oscillates that creates that consistent vibration. And the beauty about that is that the handpiece will never get hot. So the only amount of water that you would need when you're doing a cleaning with the piezo is just enough to keep the tooth and the tip cool. Okay. And aside from that, this unit in particular, it has an LED handpiece that shines at about 100,000 lux, which is very, very nice, especially when you're working in the patient's mouth. It's going to direct the light directly into the working area. Okay. If you have any more questions, if you wanted an in-office demo, I'd love to get in contact with you. I'd love to bring this unit to your office so you can do a side-by-side comparison to your Cavitron and use it on a patient and get their feedback. I'm sure that they will love it just as much as you. Thank you so much.